Are you planning to go to the UK after BDS? One of your concerns is how difficult the ORE exam is. Will I take 2 or 3 attempts each to clear it? To clear those doubts, we have with us Dr. Amaljith, who cleared the ORE exam part 1 and part 2 in his first attempt. After completing his internship in 2022, he shifted to the UK in 2024 and was working as a dental nurse out there. He completed studying for his ORE exam while he was working there. Though the route of dental nurse is currently stopped for BDS graduates from India directly into the UK, you need to remember he was working as well as studying simultaneously and still cleared his ORE exam. So let's ask Dr. Amaljit, how did he do it? I'm Dr. Satish Kumar. This is Kaizen Dental. Our aim here is to help dentists succeed. Hi, Dr. Amaljit. Thank you for taking your time today and joining us today.
Hi, doctor.
My first question to you is, post-COVID, you have gone through the entire process of ORE and cracked it in 1 year. So has there been any difference in the process of ORE pre-COVID and post-COVID, or is it exactly the same?
Actually, the exam pattern, exam structure, everything is still the same. What has changed is actually the number of applicants for ORE has been tremendously increased because there is a huge migration to UK, and as a part of this, there was a huge increase in the number of applicants for the ORE. As a part of this, now the GDC has increased the number of seats for both the theory and the practical. Coming to the ORE, the most difficult thing is like to get a booking or a booking slot for the exam. Earlier, it was only 200 seats for theory and nearly 140 something seats for the practical. But now the seats for the theory has been increased to 600. And this year, they are conducting theory nearly 3 times. And also practical 5 times they are conducting this single year. So GDS is trying their best to accommodate most of their applicants. One more thing that has been changed is that they changed the fee structure. Actually, they have decreased the fees, exam fees for the part 1 theory, but tremendously increased the fees for the part 2. I don't know why that happened. Also earlier the application was free. Even when I applied for the exam, I applied in 2020 for January. It was free, but after that, now I think we need to. There's a little bit fees for applying for the audit. Actually, coming to the booking part, also the part 2 booking is more difficult, and now the fees has been increased for the part 2. But the number of seats increase. I think it is helping a lot of students compared to the older times. A lot of them were able to get a seats, and also honestly speaking, I think that the pass percentage has been little bit increased compared to the past times. I don't know what is the exact reason for that. Earlier theory there was enough pass percentage even before. It's nearly 65% and 70%. But for practical, it was nearly 35, 40%. That is most of them were attempting the exams normally face. But now the situation is getting little bit changed. For in some exams, it's like it has reached up to 60% pass rate or 65% pass rate. So the pass percentage also getting increased slightly.
Understood. So you're telling basically they've increased the number of seats plus the number of people passing the exams have increased.
Yeah.
So currently it's a good time to go into UK and
Yeah.
try and attempt the ORE. So could you just give us a brief about how your journey was? What made you decide to go to UK? How did you start and go through the process? And how did you complete it in 1 year? Before you listen to the answer to the question, if you're enjoying the video, do not forget to hit the like button below because the speaker out here has taken time from his busy schedule to come and join you. Also, if you want to take your career to the next level after BDS, I hope you're following and subscribed to Kaizen Dental.
Actually, it's the first answer will be like by ghost days. Actually, I finished my internship in 2022, and I started working in a clinic which is nearly 20 minutes from my town. From my home, it's one of the renowned clinic in my town, and with nearly 10 BDS doctors working full time. And it is run by Dr. Sajid Thomas, was a very renowned dentist in my hometown. I'm based in Palakkad district of Kerala. But I worked there for nearly 10 to 11 months. After that, I feel like, yeah, I need to do something better and need to upgrade my career. And as usual, like everyone, I temporarily resign from the job and start preparing for the NEET. But I don't think that NEET worked well for me because, I know many of my seniors who work from far to get a government seat. Most of them ends up in private. And I know somebody, they got a government seat, but not the desired branch. And the competition level and the 3 years struggle that we usually have in our PG life, in the PG life is something that is little bit traumatic for everyone. So I just try to seek better job opportunities abroad. Why I select UK is like the first one is about the language. If you want to practice in Germany, you need to study German language. If you need to practice well in France or something, you need to study their language. But in UK, US, Canada, Australia, the language is English. So that was my first point. And compared to Canada and the US, Indian BDS is accepted in UK. That is, if you pass the exam in Canada or US, I think you need to study to get a DDS degree. Study through your 2 years, you need to go to university to get a DDS degree. But as compared to that, when you pass the ORE, or there is one other exam known as LDS, either one of the exam, then you can directly become a dentist in UK. That is the advantage of to choosing UK when you seek overseas study.
Okay, so you selected UK because of this reason. Okay, but how was your process?
That was the reason.
How was your process of studying? Now, someone who has looked at you and seen that you've successfully done it, what steps they need to take?
Okay, first of all, the major problem with OR is the fear. So even I had that before my application, before exam booking and everything. I had the fear because how can I crack it? It's an international exam conducted by the British and the Council. But what I came to know about the exam, or according to my experience, ORE is just it's not a competitive exam. The GDC is just evaluating your knowledge. That is, you whether you have the knowledge of a recently passed out UK dental graduate. That's what they are assessing. It's not a difficult exam like NEET or something that they will trick you with the options or something. No, no. They will ask the questions directly. And for the theory part and all the questions will be directly as simple and the options won't be that much confusing. They are just assessing whether you have the knowledge. And also they don't want us to buy heart or something like that completely. The most of the questions will be clinically oriented and the direct questions would be like, for example, for one of my questions, they will give you a radiograph and there will be caries you want to identify the truth with caries. This type of questions. They will give you an OPG and find out the age of the child or something like that. So it's more clinically oriented and it's not a competitive exam. And another thing is that the questions are normally repeated, not only for the theory, also for the practical aspect like medical emergencies or there is something known as OSCE and all the questions are normally repeated. Why it is repeated means they don't want us to become highly competitive or for this or something. They once somebody to know the answer in the last exam, they need somebody to know the answer in this exam also. So same questions can be asked repeatedly. So these are the two things that I will say which I found more advantage for the ORE.
Understood. So
Yeah.
you were working in Kerala at that point of time when you started with your ORE preparation. So did you move to the UK and continue with your preparation, or you studied in India and went and gave your exams in UK? How did you go about it?
No. Actually, I moved to UK in 2024 January.
But how do you manage working, preparing for old ORE, and regular stuff like cooking, running a house? How do you manage all those together?
See, as I said earlier, it's not a very competitive exam, and yeah, it's like my colleagues. I would definitely say they helped me a lot. They allowed me enough leaves, study leaves, and all. But see, seriously, I didn't quit my job or do something else because we need this is a huge. Uh, this exam is a huge financial investment, and also uh, I will definitely say that somebody who is working, who is managing the basic stuff like cooking and all, is enough. Because you need just 3 to 4 hours of constant, consistent preparation for this exam. I will definitely say, comparatively compared to my school days or in college days, I was consistent in my preparation. That is, even though I feel low, even though I feel tired, even though I feel stressed or whatever it is, I will do something on that day. Sometimes I can do better, sometimes it will be less better. Uh, it's not sometimes when I do my preparations like cavity preparation or something. Some days it becomes good because my day was good, but sometimes it becomes so wrong. But I haven't backed out. I tried again and again, and definitely I can say that after I get the booking, I work consistently. Whatever be the scenario, how much tired I am, I work this much of hours, nearly 3 to 4 hours daily for this exam. And definitely in UK, it's Saturday and Sunday are holiday, so I work from the morning to evening. But definitely I can say I've had good sleep and I used to hear music and I watch films. And
Basically, it's basically about some consistency. So even if you are working hard and you're studying simultaneously at least 3 to 4 hours. And once you get the booking, there has to be consistency in your entire process. But you told me
Consistent hard work. And that's what I say. Consistent hard work. That doesn't matter about your skills. Doesn't matter about how efficient you are. Doesn't matter about your grace so much in your college. It's after the booking you need consistency. That's true.
you had mentioned in between somewhere that there's a lot of expense. That's why you were working simultaneously. So could you just break down the cost component of giving the ORE exam?
Yes, actually, it has changed. I told you it has changed recently. For IT for application, it's like nearly £100 or something you need to pay to just give your application for ORE. And now the exam fees for theory is nearly about 585. When I write the exam, it was 800 something. Now it was reduced. And the hardest part, the practical, the fees has been increased to £4,235.
Understood. Could you tell me, were there any methods you used to reduce the cost? For example, if you book in advance, in stay, how did you manage the expenses basically?
Oh, it's a actually it's something. It's a big things, big story to tell all things about. Theory I was studying along with my friend. She's in Scotland. So what we used to do is we used to subscribe certain question banks and all together shared money. And when I was looking at the question, she will be studying something other. And when she need to look, I will log out and do something else compared to. And for stay and all the exam is conducted in London. It's conducted in Eastman College, Royal College of Surgeons England, and King's College London. All these colleges. So these are located in mostly in the central London area. So getting a hotel room book, everything is so expensive. My practical was scheduled in afternoon. So what I did was I choose to stay in an Airbnb nearly 35 minutes away from my exam center. So it was cheap, and it was okay for me to take a train in the morning to go to the exam center. So if you are choosing to, so if you are going for the exam, what I mainly suggest is taking a hotel room or travelodge in London is very expensive. So if the exam time is okay for you, because for somebody the exam starts at 8 a.m. So for them, I won't suggest. If it starts at 12 a.m. or 3 p.m. or something like that, it's okay. You can take an Airbnb, something away from the London area, and take a train in the morning. It can save a lot of money.
Understood. Any suggestions regarding coaching classes or books or anything of that sort?
Mm, Actually, recently there was a lot of coaching center that has emerged in the UK that helps us for oral preparation. A lot of coaching centers is literally looking like our NEET UG NEET exam. There are a lot of tuition coaching centers and everything. So same thing is happening. There are a lot of coaching centers available. Most of them are good, and my suggestion is always look for experienced persons rather than new advancement. Why I am suggesting about this experience is I told you the ORE, the question pattern is usually repeated. So somebody who has good experience in this um, exam pattern and all, they can guide you better than anybody else.
Understood.
Compared to books, and I won't suggest any books or something. There is something on a Spring book. It's Oxford Handbook of Clinical Dentistry. If you're planning to do, the first thing that I would suggest is read that book. It will give you a basic idea about how the UK dentistry is working, and that book is nearly 80% enough for cracking the theory dental parts. For theory, there's two exams: for medical subject exam and dental subjects exam. Dental subjects exam, this pin book is actually I covered most of parts of that book. It helped me a lot.
Understood. Looking back, is there something you would have done differently when you give your ORE exam during the entire process?
I'm not sure about it. I don't think I'd have done anything different. But what I did is that when I come to UK, I try to get connection with the UK dental authorities and dental groups and something. There is something Indian hygienist therapist WhatsApp groups and ORA preparation groups and all. So I became a member of this group and start actively participating in the group discussions and all. The problem with ORA is nobody knows the answers because there is no answer key. They won't publish the question papers or something. So only thing that we get is feedback from the all the people who have passed the examination. So we don't know what is the right answer. So what I used to do even during when I'm going through bus or during my lunch break, I usually sit at the corner of my clinic and I just go through these discussions, what they are telling, and it all helped me a lot because most of the questions are repeated, and when we go through all these discussions continuously, you will get an idea about most of the things that you haven't touched. And also sometimes we think that this will be the right answer, but nobody knows the right answer. But when you go through a discussion about everybody discussing different parts of the same topic, and it helps a lot. Also, what is the advantage of being actively participating in this WhatsApp discussion and groups? As somebody has prepared good PPTs and their hand notes about all these things, important things. For example, the fluoride concentration for children, everything they have completely prepared, so they will post it. So I used to say all those things, and just before the exam, so I can easily go through all these stuffs and all. So what I suggest is if you are moving here, don't stay back. Try to be actively participating in the any type of dental related courses or WhatsApp groups or something like that. A lot of this type of pages in Facebooks and Instagrams and all. Just join all these groups, and somewhere you will get some information, and it will help you in some areas.
That's good advice. Basically, you need to actively participate and understand what people are studying, what answers are different. That's very good advice out there.
Yes.
Understood. You finished it in 1 year, clearing both the part 1 and part 2. Do you think time is a factor? Is it easily possible for everyone to clear it in 1 year? What's your opinion on it?
The hardest part with the R is still the booking, even though they have increased the seats to a great level. It is not equivalent to the number of applicants. Even in cases, the theory booking is getting more easier because the seats has increased to 600, but still practical, most of them struggle because one thing is the practical pass rate is also low. So the person who fails, they try to book it again and all. So booking is definitely, I would say it's 90% luck and 10% your technological knowledge. And the time is not a factor because I started preparation only after I get the booking for both theory and the practical. But I won't suggest anybody to do that for the practical because practically because it's a huge financial fees and everything is so large. So you can prepare more than that. But this time frame is not a factor at all. Because I know somebody who has been preparing for long years and all but and somebody who cracked the exam with just 3 or 4 weeks of preparation. So time is not at all a factor. If you first of all you need the courage to go ahead. Comes for the booking. Always try for the booking. If you have confidence or no confidence or nothing matters because booking is the hardest part. Always go for the booking. If you get the booking, then consistently start your work. Nothing else matters. Only consistent hard work. Nothing else matters. If you have weak communication skills, if you have weak clinical skills or whatever, we can manage it. But you have to work consistently. Don't take any day off in between this.
Understood. Any parting advice to someone who's trying to get this angle?
See, actually in UK there are two exams, ORE and LDS, but completely I would suggest to take ORE. The thing is like ORE, the questions are normally repeatable and it's little bit predictable. I won't say completely, little bit predictable. So show the courage. Or is not a competitive exam like Kerala PSC or Indian NEP, government PSC exams or like NEET. They are not assessing how competent you are, from the other. No, they're just assessing what is your knowledge on this. Do you have the basic knowledge in dentistry of a recently passed out UK graduate? So it doesn't matter. And still UK is a country having huge demand for dentists, especially in the national health system. There's a huge shortage of dentists. So still, this is a good area for dentists. If you have the courage to attempt for the ORE, go ahead, uh, plan nicely. I will definitely say study about the exam pattern completely. That is one more point I need to add. I studied about the exam pattern very, very well. What are the things are normally asked? How can we pass the exams? I can add a simple note what I'm telling about. The hardest part in ORE passing is the marking. I think is something like we are doing in the Title 4. They are assessing our clinical skills. So this is the most hardest part, which normally most of the fails. So what is the thing that I look into that is for if you are preparing a crown, there are some certain measurements that usually GDC say this the 2 mm occlusal clearance and 1.2 mm buccal clearance. These are things they normally say. But slightly more occlusal clearance and buccal clearance is allowed it. And slightly less clearance proximal is allowed it. But if you do it in a reversed manner, there's a chance that you will fail. And so that is your occlusal clearance occlusal clearance is one test that is 2 mm, and if you do 1.7 or something, the chances of failure is more. But if you do at the same time 2.2 mm or 2.3, you won't fail. So these are some small tricks that you must know about when you go for the exam, because it's impossible to prepare 2 mm or exact measurements at the exam hall. So all these things, take your time, grab as much as information as you can, and contact as much as people you know who are in UK who pass the ORE, and get a clear idea how this exam works, what is the pattern, and what are things we need to give more importance, what are books we need to study, what are areas we need to concentrate, what are the and assess yourself, what is your weak area, is it your communication skill or it's your clinical skills? Both are equally important, I will say. With only clinical skills you can pass, or you should need at least minimum communication skills, because there is some diagnosis treatment planning, you need to talk to the patients, you need to explain the treatment plan, all these things are there. So assess yourself, get a good idea about the exam, and go ahead. It's a durable exam. Don't think like it's very difficult exam. If I can do it, everybody can.
That's a very good thing. Everyone who's interested should get over their fear and go ahead and give it a attempt. Thank you, doctor, for taking out your valuable time and joining us today.
All right.
If you like this video about how to practice in the UK, do not forget to check out our entire playlist of UK After BDS in India.